Move on. Viewer from Canby wants to talk about MNsure. We'll talk about MNsure generally. This viewer's specific question is, why does MNsure need $34 million from the federal government for computer upgrades? Representative Pepin, I think you introduced the topic of MNsure. What do you think about that?
Well, MNsure has had a very, very, very bumpy rollout, and there are a lot of problems with it. A few of the problems that I think our caucus had talked about in the past and when this was rolled out was didn't have people that necessarily knew about insurance, how to actually make this work, that were on the board. That's a problem. The MNsure board is really a super agency, so they're not held to the same scrutiny. So certainly, I think bringing some transparency is really important. They need to go through the same scrutiny as the other agencies do, especially when they've been giving bonuses to their executives. They don't have the salary caps on and things like that. And certainly we need to do a lot of changes to MNsure, and we will be addressing that with House File 5.
Do you know anything about this $34 million computer upgrade? Senator Hand?
The $34 million, I believe, is a federal grant that is a part of a larger set of federal grant monies that have gone to the state for MNsure. I think they're going to try to use this to upgrade some of their computer systems. But I think Representative Pepin does raise an issue. I think the MNsure structure needs to be looked at. We need to do some work on that. They have planned originally a target of over 100,000 enrollees in the private plan part of MNsure. That hasn't happened. They've downgraded that. I think the most recent target was 67. I think we're at about 40,000. The real question is, if you don't get enough people enrolling, you don't have the funds to make that be self-sufficient. And the law says that that exchange has to be self-sufficient. I think we've got a problem. We should be working on it. It is a governance problem to some degree, but there may be other issues too. So I think we need to pay some attention to that.
Well, it clearly was a rocky rollout. I think what people need to remember is the Federal Affordable Care Act required the state to develop health exchanges, and we had two choices. We either could let the default to the federal health care exchange, or we could develop a state-run exchange, and we're developing one, and it'll continue to evolve, I'm sure. I think there was a lot of agreement that the state of Minnesota could probably do a better job putting an exchange together than just default to the federal exchange. The jury's probably not in on that yet. We're going to learn more. Wisconsin made a decision to go with the federal exchange. Minnesota has a state-run one. I'm absolutely open to changes that make it function better, but I think the truth is more Minnesotans are insured than ever. Our number of uninsured Minnesotans are among the lowest in the state. So we're doing an awful good job in Minnesota making sure our Minnesotans have insurance. We've done that for a long time. That's not new to Minnesota. It's been part of the Minnesota healthcare model for a long, long time. And I look forward to some constructive input on how we can make it operate better.
MNsure certainly had a very rough start, but it's more than a computer program. And as we know, there's almost about 300,000 Minnesotans who did not have health insurance before MNsure that now do. Our uninsured rate went from 8.2% down to 4.9%, which is now the second in the nation, next to Massachusetts. And we know that when people have health insurance, it lowers costs for all of us sitting around this table. In that your hospitals will say that there's about $600 million of uncompensated care a year. We pay for that. When people miss work because they don't have health insurance and they're not as healthy, productivity suffers. I know as a teacher that when students don't have health care, they miss more often and don't do as well, and that's a huge loss of production. So we have to look at the overall picture. And, people hear, well, it's costing more or premiums go up. Well, first of all, people are getting health insurance that's truly health insurance and will cover things that it was only in paper before. But somehow we tend to forget the double-digit premium increases on insurance before the Affordable Care Act, up in the 30–40%. I mean, we remember, all of a sudden we've kind of forgot that, of what the prices were. But I thought Minority Leader Thiessen made a really good point last night at the Chamber, where he said that this was not a health reform bill. It was really an insurance company reform. And quite honestly, in a way that is. It's kind of to put the consumer more in par with the insurance companies. And you know, we're not going to go over the details. But is it perfect? No. But when you can put more people on health care insurance, it really benefits the health of the whole state, but also saves costs for everyone in the
Well,
state.
I would agree that Speaker Thiessen was right that it was a health insurance program, not really a health care program. But I think that does get to one of the real problems with this approach. When you don't give consumers an opportunity to make choices and to have an investment in what they purchase, then you're not going to get the kind of marketplace that will affect the prices that they pay. I think one of the downsides of what has happened with the Affordable Care Act is you've lessened the choices that people have, businesses in particular, and it's caused, I think, premiums to go up, and because you've got fewer choices about what you have to cover in your health insurance. I'm not convinced that this is the right path that we're on. I think that we're in an experiment. You're right. We'll see how it plays out here in the next few years. I think we need to be prepared to look at something different. I was much happier before the federal government came in and said, here's how you got to do health care. I think it would be better off if we could sit around the table and say, let's deal with Minnesota and not have to worry about all the laws. We complain about all the federal laws in education. I think in the future we're going to be complaining about the federal laws in health care. We should take care of it ourselves. We shouldn't have the federal mandates to make us do it a certain way.
I'd just like to add to that a little bit. You know, Representative Marquardt talked a little bit about those that were uninsured, and Minnesota had one of the, probably the best healthcare system before this went into effect. And it's true that not everybody had health insurance, like you said, 8% or something, but keep in mind that a lot of those people had access to it and chose not to get health insurance. That was a conscious choice they decided to make, and under the new law, they were penalized for not doing so. And the results have been, I think it was something like 40% increase. That's not an affordable care. So I hope that all the caucuses can agree on part of the House File 5 is encouraging us to go for federal waivers that would allow Minnesotans to get those tax credits without having to be able to go where they want, to be able to get these tax credits, not kind of force them into a box to have to use this system. So I'm hoping that maybe we could find some agreement on that, because what we all, I think, want to accomplish is we want to have better access and affordable health care for all, and so we should look for ways to make that happen for Minnesotans.
I think the interesting thing about that, and Judge, you know, is there's currently a lawsuit in front of the U.S. Supreme Court on whether the idea of these tax credits to pay for health care are constitutional. And, I mean, we're going to hear from the Supreme Court on that, but the interesting thing about that is it only is going to affect the states that have federal exchanges. So if it turns out that the U.S. Supreme Court rules that the federal exchanges can't access the tax credits to buy down the cost of insurance, Wisconsin is going to have taken the wrong path, and we in Minnesota will probably be pretty happy that that we made the decision to have a state-run exchange.
For viewers who are wondering about that issue, I won't speculate about the results, but there are about 34 states that have chosen to be outside of the federal system, 16 states or so that have chosen to be inside. I think I have that right. And the case that you're discussing, Senator Bach, is before the U.S. Supreme Court and will likely be decided and announced by the end of June. So it will be very interesting to see how that will change if it comes out saying that the exchanges can't use the subsidies. Then life gets very interesting on a variety of levels. I think we could say that without getting into any trouble here.